Hello, everyone. My guest today is Jacob Templar. He is in charge of research and development for Physical Therapy Clinic of Rochester. Hello, Jacob. How are you?
Good. How are you? Thanks for having me on.
So tell us about the clinic, where you guys located, and what is it that you specialize in?
Yeah. Our clinic, Physical Therapy Service to Rochester, is located in Rochester, New York, which is like upstate New York. So we're probably like 6 or 7 hours away from New York City, near Lake Ontario. We are a one-on-one outpatient, like kind of orthopedic / like pain management physical therapy clinic.
Mm-hmm.
We tend to see everything from TMJ to low back pain to, the run-of-the-mill orthopedic injury, but we also will see people for vertigo and a lot of chronic pain and headache and migraines is what we're really known for more so.
Very interesting. And when did the clinic open up?
So the clinic has been in Rochester since 1993.
Oh, wow. So, okay. And how many owners are there now?
2.
So there's 2 owners, Jenny Teller, right?
Yep, she's the current owner. And then previously it was owned and I believe started by Catherine Hill.
And she's no longer has stake in the company, and she still does.
No, yep, she retired like 4 years ago.
Got it. So there's only one owner currently.
Yes.
Got it. Understood. Okay, so she acquired the clinic from a different owner in the past, correct?
Yep.
All right. Very cool. And so in terms of Jenny's background, do you know if she worked for a clinic, hospital, nursing home? What is it that she did?
So she started at a hospital in one of the, I believe it was one of the VAs locally, and worked in the hospital for a while. Then through the hospital work, transitioned into this company and has been here for over 10 years. And so was a staff therapist under the previous owner until, 4 or 5 years ago when they transitioned the ownership.
I see. So she's been running the clinic for the past 5-6 years, you're saying, right?
Yeah, they started to transition it over, and then she completely took ownership.
Got it. Jacob, so tell me, prior to joining Physical Therapy Clinic of Rochester, what did you work? What's your background? What kind of certifications do you hold?
Yeah, so I used to work in Syracuse, New York at an outpatient orthopedic and surgical type practice where my specialty was treatment of spine. So I was one of 5 therapists there that pretty much made up our, we called it the spine council. And we came up with standards of care for post-op and worked with the surgeons to come up with those. And then the location I was at, I was one of 7 therapists, and we had 7 physical therapy assistants. And I would see the majority of anybody that came in if they had a lumbar, thoracic, or cervical issue. Through that whole time, I've been doing the training in McKenzie, or most people know it as McKenzie, but it's termed mechanical diagnosis and therapy. And then last year, I received the certification in that after the certification exam in May of last year. And then this year, I sat for our orthopedic board exam and passed that.
Congrats.
Thank you.
Established accomplishment. Very nice. Okay, very nice. So, and you treat specific type of population within the clinic, or you guys kind of treat all types of population, or each therapist has, specific, kind
So we all treat kind of everything, but Jenny specifically is most known for in the Rochester area for her specialty in treating people with migraines and headaches. So the majority of her caseload will make up of migraine and headache patients. And she has a lot of local neurologists that maybe specialize in seeing people with those issues that refer directly to her. And then the other therapists and I will see kind of generally everything. I will see more of some of the people that have some of chronic issues because of my comfort level with certain people that have I would say what most people would consider to be like hard cases. I tend to see a lot of those, where certain local physicians that I have a good rapport with will send me, okay, this person's been through like everything, and then they'll refer them to our office to see me, especially some local like pediatrician offices and things like that. I may see a lot of their orthopedic cases.
Oh, so you guys actually see pediatric population or only orthopedic pediatric?
So only orthopedic pediatrics. But we have seen people as young as 6, and I have a patient right now that's 93. So kind of the whole gambit.
Yeah.
We're just most known because there's not many places that are just one-on-one with patients, and a lot of physicians really value that and appreciate that. And if the patient had a bad experience at what we would all view as being like the typical model of physical therapy, they'll often be referred here.
So let me ask you, speaking of one-on-one, so I'm assuming the reason you guys are one-on-one is because you're out of network. Is that true?
No, we're actually in insurance network with almost all major insurance carriers. The only one we don't take is Medicaid because of the extremely, at times, low reimbursement rates. It's like very hard to kind of, hit your bottom line if reimbursement sometimes can be as low as like $10 for a visit.
So you guys, do you have GHI, for instance? Do you take GHI insurance? Do you have that?
I'm not as familiar with that one. The main carriers that we see around here in Rochester is like Blue Cross Blue Shield.
Sure. I'm just, the reason, what I'm asking, what I'm trying to get to is, if you have patients that have insurance and they pay you under $40 per visit, for instance, how do you manage to see them one-on-one, and how long the session usually runs?
Yeah, I mean, so typically in our area, there are very few that ever run under that. So like, the only ones we may have some difficulty with is like, say if they come in and need an interpreter or something like that. Sometimes the cost of the interpreter will be more than we're reimbursed. We're not going to not see that person, but we'll take that into consideration as far as like trying not to like run over on time with them and things like that. So we're saying like, considering that, like we still want the best for the patient, but we have to consider like from that end of the things, like how are we running into somebody else's slot or things like that, and then how does that affect everything with the flow?
And how long is your typical treatment session?
So we do evals for 45 minutes, and then follow-ups are usually a half an hour.
Nice. Okay. Very good. And how many people work in the clinic now?
So we have 4 therapists, and we have 2 administrators that do like the insurance authorization, scheduling, kind of all that stuff. And then we have an office manager who's kind of like a jack of all trades and does our billing and things like that.
Sure. Okay. And so there's 4 physical therapists. Are they all full-time?
Yeah, we're all full-time. And there's some flexibility with that because of new things with like telehealth and things like that. Like we even have one person that's going to go to like making up some hours with just telehealth, things like that.
And Julie treats patients daily, or is she only treats patients at a certain amount of days during the week?
So she works at Monday through Friday, and treats. She usually starts at 9 or 7 a.m. and then usually finishes like the latest day, maybe like a 3 p.m.
But she continues to see patients, clinically as well. Okay. So with COVID, how has your treatments changed? How has the clinic, adapted to new kind of rules and regulations? And do you have more telehealth visits? Do you, schedule your patients differently now?
Yeah, I mean, in general, we had been able to be much more flexible than I think a lot of other practices were. Especially like the bigger you get, the harder it is to just like transition to doing things differently. I mean, the biggest thing was that having to wear a mask obviously all the time reinforced like masking procedures, keeping track of if somebody's been out of the state and it is the state that they travel to on quarantine list. So we doing telehealth, that's actually allowed us to be more flexible. We had a time period where 2 of us were just doing telehealth for like 6 weeks, I want to say. And overall, the visit counts, you know, everybody was kind of not getting in a lot of patients. So we were able to do that. And then we've been kind of, we'll have it peppered into our schedules, like people that are either in at-risk populations or just not comfortable yet going out too much in public if they don't have to, where we'll see them telehealth, or, you know, maybe in some of the pediatric populations, like the parents are working from home, but the parent's going to be home, but can't necessarily travel with their kids. So we'll see them during the day via that. Or like I said before, like Rochester's a big college town. We have like probably like 5-6 universities. So there's a lot of people that'll be like traveling back here or to their home. And we have some people that are like in quarantine, you know, states where in New York, they have the quarantine for 2 weeks. So we're seeing them for that 2-week time period, usually over telehealth. And if they are like, you know, wanting to come into the clinic or really should be coming in because they need certain things we can't do, you know, not being able to put our hands on them.
So since you guys are, you know, orthopedic specialists and, you know, you guys have McKinsey certifications, how has telehealth been different for you? You know, do you find it as effective, or you definitely, you know, need that touch that you guys used to?
For the majority of people, just because the skill set of having the McKinsey, I think makes it much more of a smooth transition than for a lot of other people that aren't used to practicing that way. Because a lot of things we're doing is like visualizing range of motion, having somebody else like check very specific to them, like baselines of like, it hurts when I do like some certain activity or some kind of joint movement. And we can easily like show them something to do that they can reproduce at home without needing us. And if they even needed something where they would need a pressure, like an overpressure or some kind of specific stretch, we can often get creative and figure out a way that they could kind of do that at home.
Okay. And typically your frequency is the same as in the office, or it's different?
It usually will be about the same, you know, depending, because if somebody has the ability to come in and they're not progressing in a way that we would normally expect or would like, then we may then encourage them, okay, we should really get you in the office, even if it's just for one visit to see, you know, is there something I'm missing that I can't see on the screen?
Got it. Okay, very nice. And how big is your office? How many square feet?
It's around like 1,300 square feet, so it's not very big.
1,300. Okay.
Yeah.
Okay, so it's okay. And you guys, what system do you guys use for documentation and scheduling?
We just started using TheraOffice.
Did you switch from a different system?
Yeah, we were previously using Clinician.
And why did you guys switch?
The main issue is that we were happy with the documentation and other features, but we had some issues when they transitioned ownership in their company where we weren't getting the same support that we needed for certain issues, and we were having issues with our billing and things like that, not turning around fast enough and things like that. Things that as a business, it's like ended up costing a lot.
Sure. So the documentation you had no problem with is just the aspects of billing and practice management and support, right?
Yeah, it changed from what they initially signed up on, you know, transitions of our ownership, transition their ownership, and then somewhere the wires didn't cross the way they should have been.
And you mentioned billing, so you guys do billing internally, or you outsource it?
Yep, so our office manager does billing now. So she's often able to get claims out within a few days, and then we're getting our reimbursements back within a few weeks. Usually faster than that. And because we're smaller and there's only, you know, there's a therapist, there's the front desk, and then there's her, we're able to, like, if there's a problem with whatever is on our notes or we need to change something, then it often usually happens within 24 hours and we're able to turn that around.
But you guys use the integration feature of the system, right? She uses the integrated billing feature of therapy?
Yep.
Okay.
Yeah.
Very nice. So in terms of census, right, pre-COVID, and now I guess we're still in pandemic. Are you seeing less patients than let's say in February or January of the year?
Yeah, we definitely are, because before, myself and one of the other therapists, we're actually just having a fourth person start at the end of August. Two of us had been working 5 extra hours a week, actually,
Right
to get
now or pre-COVID? Pre-COVID, okay.
Yep. And then the census dropped to, which from talking to a lot of other therapy offices, the average was like, most people were seeing like 10 or less evals a week. And that's about where we were at. And now we're kind of back up to almost our normal numbers, if not exceeding them again.
So you're back to where you were pre-COVID pretty much at this point.
Yeah, for the most part. And I think part of that is being in New York, things have quieted down quite a lot since 4 months ago.
Definitely. But you guys, you all remain on payroll as during COVID throughout all the months, right? All how many? Two or three therapists were on payroll, or one of them was actually laid off?
So 3 of us.
Yeah.
Because now we're adding a fourth person.
Oh, you're adding that the person wasn't on payroll. I mean, wasn't hired before. Got it.
No.
Okay, makes sense. Okay, very good. And so, and how many visits do you guys usually have weekly between treatments and evaluations?
Somewhere between it's usually maybe around like 65 to 75 per person.
Oh, per therapist.
Yeah.
Okay, so it's okay. And you have certain productivity you have to meet.
I mean, typically that's something that we track, but it's not like something that's like, it's a set in stone thing where we're like super, super strict, because being a small office, there's other responsibilities for all of us anyways, like different marketing aspects, management of our social media, a lot of other projects that even if we don't have patients, there's usually something to do.
So speaking of marketing, so what kind of marketing tools you guys use, and what kind of marketing media you utilize on a monthly basis?
Yeah, so most of the stuff we're using right now is we're still like transitioning more towards a more sophisticated marketing plan and system, where right now we're really just using social media and building rapport with specific referral like physicians and other places like that, like maybe relationships with like gyms or certain businesses or other people that are in like kind of allied health professions.
But do you guys keep track of referrals?
We can track that in our system, and then we'll kind of like strategically look at it. Like say if I were to do something specific, like some kind of specific event, or like send some kind of specific letter to a physician, we'll kind of keep track for a while. Like, okay, what effect did that kind of have on the rate that maybe that person referrals? Even though sometimes they may be somebody that's a regular referral, we'll still even see like, I'll just send them something to be like, hey, happy birthday. And
sure. Yeah, but I'm just curious, you haven't utilized that yet, right? From your previous system or current system, you haven't been using reports like referral report, for instance?
Not specifically all the time. Like that's something we keep track of, but it's not something that we are currently like super strictly monitoring.
All right. And if you're to put it in percentages, what percent of your patients come from doctor referrals, from word of mouth, and then maybe from like social media?
Oh, it's probably like 90% referrals.
From doctors?
Yeah. And then the rest would make up like the next vast majority is usually like people that are returning patients from the practice being here for a long time, or then word of mouth would be next. Where like somebody's friend told them about us, or like one of our other patients' friends, or things like that.
Okay. All right. Very nice. And do you keep track of a cancellation report, for instance?
Yep. Yeah. And we keep track of that for everybody, and then try and figure out internally, like, okay, if somebody's is really high one month? Like, is there a reason for that? Or, was it just like a fluke? Sometimes that happens where, like, say somebody cancels, because they were sick, or, different things like that happen.
Got it. And you keep it per therapist, or you keep cancellation rate per clinic?
We usually do per therapist. So that way, if there's something that, like, on an individual level, we can maybe do differently that somebody else is doing better, or something like that. Like, what,
Okay.
if it can be changed, how can we change it, kind of thing.
And so I've always, it's an interesting question on all clinic owners. What is your average cancellation rate in the clinic?
I believe right now it's like less than 12%.
So it's under 12%. Got it. Okay. That's, healthy numbers. Okay, very good.
Yeah, like, it's typically much even lower than that. We average we're like below the national average for number of visits per case, and like our cancellations are far below like any other company that I've been that I worked at before, or even when I was a student, like getting to kind of know some of those numbers. We're kind of far below usually those numbers.
Okay, that's good. It's really, really healthy numbers. Very good. And what some of the reports you guys do utilize, like, now on a monthly basis, if any?
Yeah, so we'll look at, like, typically it's just like visits per month for the whole clinic, like how many of those were new visits, how many of them were follow-ups, what is everybody's kind of no-show cancel rate, and then for the clinic, what is it, what are our visits per discharge, those kind of things. It's typically the main area that's our focus, to see, like, okay, are we bringing in a lot of new patients, but are they like dropping off really quickly? Like, why is that? Or like, are we making sure that we're getting them to, getting people to schedule, and then, like, are your visits down because they're actually getting better, or is it like you're doing something and they don't like you, so they're leaving?
Yeah, that's really important to look at, of course. Okay, and you guys have like weekly meetings with staff, or is that something you guys do?
Yeah, we'll do like a monthly meeting with like the clinic, to discuss like different things like this, and then if we do anything like weekly, it's usually like more casual, like, hey, like, this is what we have coming up, or things like that. And we'll do kind of like a couple of us do a monthly marketing meeting on a different day, like around lunchtime, to discuss like what is our focus going to be like for the next like month or so, and how are we doing on things that we talked about like last month.
But so do you guys spend any money on marketing?
Right now, not really. Like, we almost spend $0. Like, we've spent more this year than we ever have before, but most of that's just through like doing certain events, or like boosting social media posts or things like that.
But you're not really boosting any social media right now.
Yeah.
Got it. Okay. Very good. And so what would you say the biggest expense for the clinic is on a monthly basis? Is it payroll, rent?
It's probably the payroll.
Payroll, of course, yeah. And equipment-wise, since you guys do, treat different type of population, what kind of equipment you utilize? Like you mentioned, you treat vertigo in the clinic, you treat TMJ. Any specific equipment you guys found really helpful, and something really?
We do have a cervical traction unit that we use occasionally. We don't use it like on every neck patient. There's certain prediction rules and stuff like that we'll look at to see if it's more appropriate for.
So there's the cervical traction. So what kind of patients would you typically use that tool for?
So we'll look at like if they come in with radiculopathy, and then meet some of these like in the orthopedic exam, for example, there's like clinical prediction rules that if there's certain signs and symptoms that you have, the success rate of that treatment is going to be really high. So like if you have 3 out of 5 of them, it's like an 80-something% chance that if you use that early on their management, they'll see much better improvement. Versus if they have 5 out of 5, it's like a 94, 97% chance that they get better much sooner. So like, I'm going to look at that and say, okay, those are the people I want to be using it with versus everybody. Because it's like, that's important to their management. And I mean, technically, a business-minded person would look at that and be like, well, traction bills less too. So like you wouldn't want to just use it on everyone.
Sure.
Not only from an efficacy point, but like if you just put everybody on it, then like per that time, you could be doing things that are going to be better for them, and it's technically reimbursable at higher rates.
Sure. Sure. Okay. So any
Then
other
we have what's called a repex table, which is more well known for like McKenzie style treatment, where if you can get a lot more reps of like extension, and it moves the legs as well as upper body. And we actually have weight training equipment like a barbell, dumbbells, cable crossover.
And you do vertigo?
Not specifically right now. In the past, we had Frenzel goggles, but ours are kind of old and don't work anymore.
Oh, okay. So you did utilize goggles before.
Yeah.
Okay.
So a lot of times it's learning better to like how to like best look at that and see what their symptoms are like. And then we have some stuff for like agility and bands and, you know, typical physio balls and kind of like a basket of like stuff for hand therapies.
And so you do see hand therapy patients as well?
Not as many, because locally there's actually the University of Rochester has a fellowship program for certified hand therapists for OT and PT.
Sure.
So a lot of people will go there, but if we've had maybe past patients or somebody that's in our common referrals, we'll sense, you know, occasionally we'll get some of those people. And things like standard post-ops like carpal tunnel and things like that, that's, you know, I'm not gonna like downplay what occupational therapists and other physical therapists can do, but post-op procedures that are straightforward are much different than unique like hand surgeries where you maybe need that better skill set of being a certified hand therapist.
Right. So you don't do any splinting, just.
Yeah. Yep. We don't do anything like that.
Got it. Okay. Very good. And for the clinic, so you guys keep track of your growth rate, like if the clinic is growing in terms of like numbers of patients, you know, amount of revenue and things like that. Is that something, you know, keep track of that?
Yeah. Yep. That's obvious. Yeah. That's something we're obviously looking at all the time to make sure like, okay, we're trending in the right directions or staying where we need to be. And, you know, like the goal isn't going to be to like open 1 million clinics or anything like that, or like have a, you know, huge facility that costs a ton of money. Obviously if the revenue goes up, then that obviously gives the staff and therapists, like that's better for us in general, because now we have more room to like, okay, we can either add equipment, or that leads into, okay, people can get pay raises or things like that.
Okay. And so what would you say your favorite continuing education resources are?
So other than obviously I've used like the McKenzie Institute to take their courses and stuff. You know, I found those to be valuable. They are kind of, for some people, somewhat cost prohibitive because each one is like $650 to $700, and then travel. I use specifically for my orthopedic exam, I use MedBridge, and I found that to be a pretty helpful resource to where I took a ton of hours on there. Like I think I took like 300 hours on there of stuff. They have some great courses from like true experts in our field, like in physical therapy. They have stuff for OTs on there. You know, like Chad Cook has a really great series on there for orthopedics. There's some people on there that have worked with like Kevin Wilk that are, you know, shoulder experts. There's another resource that I use, but I don't think it's approved for American credits, called Trust Me Education. But they have really good courses on there that are at least worth.
Is that European course?
Yeah, so that's European, and they also are approved, I think, for Australia. But they have really good courses on there too. And it's fairly cheap. It's like $100 for a year.
Oh, wow, that's really nice.
So it's at least good to like have those lectures. And another one that I used recently is the San Diego Pain Summit had their conference, and they did it virtually this year. And initially it was free if you wanted to sign up. for all their lectures. And then once you signed up, they actually made it was like a one-time $50 fee for signing after you signed up, where now you have lifetime access to all the courses that they've ever had.
That's a great deal there. Nice. Jacob, so do you do workshops? Let's say you complete a course and then you educate your fellow staff on what you completed the course on, and like any interesting material you found.
Yeah, like occasionally we'll do that and like have discussions within the clinic and things like that. We haven't done anything super formal yet on that, like with workshopping or anything, but we've done, like I've in the past done some workshops for like say some pediatricians' offices.
Okay, nice.
Like gone in and discussed some orthopedic issues that they maybe don't feel super comfortable with, but have a lot of patients coming in for.
Okay, cool. So my last question would be, what is your long-term goal, and what is clinic's long-term goal, if you know that?
Yeah. Well, my long-term goal is that I'm very interested in like education and research and advancement. So like my goal is never to stop working as a therapist, because I really enjoy the clinical aspect of it, but I would like to get into at least like clinical teaching or part-time like professorship. And I'm working on some research, like the first of probably many research projects this year. I'm also involved in the local district of the American Physical Therapy Association. I'm our local Finger Lakes district secretary. So I have a lot of aspirations to not only talk about changing certain things in rehab professions for like OTs, PTs, chiropractors, but like to actually get some boots on the ground and like actually do stuff to make some changes.
So like advocacy work is passionate.
Yeah. I mean, like all of us go to school, like, occupational therapists go to school for a long time, PTs go to school for a long time. And then we come out and a lot of things are not always what we might expect. And like our reimbursement rates for what we do isn't as good as it should be, especially like the skill levels we do have. So there's a lot that can be worked on to help all of us, advance our profession to be in more of a better place than I think we currently are.
Yeah, definitely. Speaking of, actually, one question I did forget to ask. So average reimbursement rate, do you guys keep that within the clinic? Because I mean, for New York City, I'm assuming it's much lower than in Rochester. Like average, like New York City reimbursement rate, I would say if it's in network clinic, it's about $70, depending, on Medicare, the amount of out-of-network patients within the clinic. What is your average?
So I can't give like specific dollar amounts just because of the contract
range, yeah, like within
wording, but it's probably about the average. We're probably in that same like $60 to like $80 range.
Got it. Okay.
That most people fall within.
Got it. Okay, yeah, because there's a lot of listeners. It's interesting to see people on West Coast or up north, what to expect from average reimbursement.
Yeah. Versus like New York State, we typically have the lowest reimbursement rates in the country.
Yeah, we do. That's why I was really surprised that you say you guys do one-on-one treatment and you in network, because I've interviewed plenty of therapists and most of them do one-on-one treatment, but they out of network.
Yeah.
That's the way to make it feasible.
Well, and honestly, there's some insurances here that I've seen higher reimbursement rates for the like less time. So say like if you bill, like we're still spending that time with the person and billing for the units of the time that we're with those people, but we're having rates that are like as good as some of these, like I was a part of a very big clinic and we're seeing tons of patients, and I'm like, but then they told us they weren't making any money and we're not making money, and like you got to see more patients. But then I'm here and we're seeing people one-on-one, we're like, you have a manageable caseload, and it's like the reimbursement rates are just the same. And I have less stress for like cramming in patients.
Sure. I mean, these, I guess, advantages of working for a smaller clinic versus a corporate type of structure, right? Where you have a clinic with hundreds of locations.
Yeah, and there's pros and cons to both, right? Like you get different experiences at both.
Definitely. All right, Jacob, I really appreciate your time today. It's really, informative to me, see what it's like to, work in a clinic in Rochester up north. And we'll be in touch. Thank you.
Yeah, thank you.